Jag ser det också därför att vi har ett imponerande arv bakom oss. Det råkar slumpa sig så att vi nästa år...
Mr. Kristersson, why did the Swedish government decide to finance REHSAM?
Well, basically because there is a lack of knowledge and evidence-based research that goes into to the practical social work when it comes to helping people from sickness leave back to work again.
Professor Linton, what is the main focus in your project?
We work with early intervention for people with musculoskeletal pain problems, and we're out in the workplace working with both the workplace and workers.
What have you found so far?
We have been able to identify people very early on with back pain and neck pain. We provided them with a cognitive behavioral approach both to the supervisor and to the individual suffering the pain. And we found in our preliminary results that this has quite a large effect on a number of things. One is the risk to develop long-term problems, and the other is on actual sick leave.
Well, my research is about Iraqi refugee women with persistent pain. This is a vulnerable group. Many have suffered from trauma and abuse in their home country. They've had to escape and resettle in a strange part of the world. This means an enormous stress which affects the health, both physically and mentally. The aim of this project is to develop, you may call it a toolbox, for the professionals within primary health care in order to be able to offer these women sufficient treatment or rehabilitation according to their specific needs.
The main focus in our project is to evaluate a web-based complement, an educational program that is a self-management program as a complement to multimodal rehabilitation. They have opportunities to do reflections in relation to exercises. They can see films, they can train and learn about coping strategies, self-efficacy, and we have a lot of questions for them to work on. And then we think that this will improve their knowledge and their awareness, body awareness, and also learn how to cope with work and life situations.
What can you say about the importance of a research program like REHSAM?
Well, it's really vital because as a researcher we can sometimes get money to do our studies, but the real problem is transferring what we know about these things to actual practice. And REHSAM has focused on implementation, so we work very closely with the community and with health services, and so this is something that we believe will be very applicable and that one can pick up in primary care and in occupational health care.
The more we can connect practical social work on the field, so to speak, with frontline research, the better. We have done that. We haven't been so successful so far in Sweden, is my belief. So all platforms and places that connect these knowledges and these professions to each other is of real importance.